I'm George Flynn, and you're watching In-Depth TV. Today, we've got a program that you do not want to leave before it's over. It's very informative. This man, Dr. Yogi, how do you pronounce your whole name? We got to know that.
Yeah, Kumar Yogesh.
Yogesh.
Mhm.
Okay. Well, that's easy.
Yeah,
But he likes to go by Dr. Yogi.
Mhm.
He is a pulmonologist
Correct.
in Jackson,
Yeah.
Madison County area.
Yes.
And he has written. He was kind enough to give me a pre-publication version of his book that he's written, and it's about healthcare. It's about your healthcare, and it's about what should be done for the healthcare crisis. There is a crisis, and he knows about it as well as anyone else. He's a practicing physician. He is not out there pontificating. He comes from the actual practice of
Actual
medicine.
word, yeah.
Yes. Well, Dr. Yogi, tell me what the premise of your book is.
The premise of the book is healthcare crisis in America. And it's a crisis, in my judgment, is created by politicians, government, and third-party involvement and regulations. There is no crisis on the side of good doctors and good nurses. We have plenty. We have probably the best doctors and best nurses in America. And the people are very generous in America, and they want to treat their doctors and nurses with respect. So where the crisis comes from?
Right. Where is this crisis? Because everybody's talking about you cannot get health care, you cannot afford health care. What happened?
I think these third parties have taken over the system for their benefit.
Well, now, by third parties, you mean insurance companies?
And
Okay.
with the help of government, of course.
Okay.
Because America right now, we have about 50 million Medicare population,
Okay.
70 million Medicaid population, and about 20 million veterans. So that's half the country under the control of government insurance. So anytime you bring insurance, it's not only Blue Cross or Aetna or United. Big Daddy is also
Right.
is covering 120, 30 million lives, plus population are the people who work for government. They are under some kind of government plan too. And meaning government has a CMS, which is an agency that controls the policy of Medicare, Medicaid,
Center for Medicare
Services,
Services.
CMS.
Uh-huh.
Basically in their hand, they are the one in charge of all the dollars that flow through Medicare or Medicaid.
But now there's a movement out there that says we want Medicare for all.
Right.
I mean, and that's going to cut costs. That's what we're told.
And if you believe that, you will be I don't think American people can be told that way, but we will be the most, I'm not stupid, but I'm looking for a word like that. If we believe that.
We'll be gullible.
Yeah, we'll be gullible. That's
Well,
it.
that's what.
Because these people have created the system. And if we keep asking them to fix it, how can that is going to be happening? I mean, these are the cooks who have messed up the spaghetti, and we expect them to make a new spaghetti. Is going to be more messed up.
Well, why is it that Medicare? Let's just take Medicare, and a lot of people are on Medicare. Why is it that it is not working?
Medicare itself is a good program. The cost has escalated in our healthcare system because of many, many factors. And it's a common knowledge, Dr. Flynn. Anytime you Google or research the healthcare waste, you're going to get standard answer. Any agency, I mean, I can guarantee you will get 100 agencies, reputable, liberal and non-liberal, that there's a 30 to 40% waste in American healthcare system. And we spent $3.65 trillion last year in 19 for healthcare, according to the CMS website. There's a National Healthcare Fact Sheet.
Right.
And that's a large sum of money. I would think a lot of people do not even comprehend what a 3.65 trillion is, but that's a bigger than entire GDP of Canada or Brazil and countries like that. And these are large countries. And this is their entire GDP, and we spend that money just for healthcare in America. I mean, isn't that insane? And out of that, if 30 to 40% is a waste, which I do believe that it is a waste, that comes to almost $1.2 trillion a year.
And I read that in your book,
Yeah.
the 1.2 trillion. And what is this waste we're talking about?
That's exactly the very suspicious thing is in about 2009, National Institute of Medicine, IOM, Institution of Medicine, I think, and it goes
Right.
by a different name now.
Right.
But IOM is a very reputable, it's a liberal organization,
Right.
but they did a bunch of studies and they came up with extensive data. The administrative cost is 10%, overhead is 10%, overutilization is and that what the components of the waste are coming from. And they came up with a figure of $750 billion in 2009. So that number now has grown up to 1.2 trillion in the waste. And the very suspicious thing is you research that now. At that time, everybody ran with that data. Washington Post, Atlantic, New York Times, and then guess what happened? Obamacare came. And then this thing is gone. Nobody's talking about waste anymore. So it's very suspicious, isn't it?
Where were they saying the waste was?
They are saying that, of course, they blame doctors.
That's what I was going for.
Which is not true, because they, meaning the liberal organizations, always have philosophy that they are better manager of your money. So they can control it better than patient or doctors. In their mind, they are not capable, and which is very untrue. Actually, it should be reversed. Conservative philosophy would say, well, if patients and doctors are involved directly in charge of their own money and services, this waste will go away. Well, these people are determining, right, there is waste, but their recipe is more waste.
Okay.
So
to
they
fix it.
Right, they want to fix it with what has failed already. So you keep giving the same dose of medication to a dying patient, guess what? You're going to have dead patients.
Well, what I'm seeing is that we have regulations to the point that you have to get pre-certifications, and it just draws out the healthcare process, the sickness process. And I'm sure you see it in your practice.
That's what it is, and the payment system itself is a root cause, one of the corrupt system, CPT. Nobody knows. I mean, you ask any doctor who is practicing how the CPT, it's just a guesswork. And AMA, which used to be a doctor's organization and not anymore in my mind, it does not represent practicing doctors' interest properly. They own CPT pattern or ideology, and basically that's what governs all the money paid. And even after 30 years, I don't understand. Like
Well, the CPT,
it's a current procedure terminology.
It's the procedure that's done.
Right.
The procedure, but the ICD is the diagnosis.
And that is another confusing.
And so you have to have the correct diagnosis, ICD, to go with the CPT.
Correct. And correct diagnosis in the mind of system, not doctor-patient.
Oh, yes, it's a system.
Like I may see
The
you for a
system-
bruised elbow, and my diagnosis is bruised elbow, and you as a patient are satisfied, but system may not be satisfied. So I have to look and dig for so-called diagnosis that satisfies ICD system and CPT system to pay me, and that may waste my 5 minutes right there for no reason.
How much time, and we're presenting this from the doctor point of view because we want the patients to know why they have extended waiting times, why they have trouble getting it through to the doctor. How much time for every hour you see patients, how much time do you spend on the computer logging data or clicking boxes?
Easily more than 50%.
So you would say another half hour.
Right.
Okay.
And my interaction with a patient, if I can be done in 10 minutes, for example. Right now, with the pressures of documentation that I have to do for CPT is a system that pays. And if I don't document according to their needs, I don't get paid, or I may get even penalized. So instead of 10 minutes, I just see you for 2 minutes and adios. and then I go work with computer for 8 minutes to complete the documentation. So really, you are here to pay me for my time, and you're getting nothing. You're getting 20% of my time instead of getting 100%.
And that's part of the system that you say is, in this, is more than broken.
Right.
Yeah.
It is. If I decide that you need this medication for your asthma, I have to spend 5 minutes just to fight with insurance. Or my nurse may have to spend another half an hour. So patients are shortchanged instead of me giving you a correct diagnosis and correct treatment, which is what you really are here for.
Right.
And as a doctor, I should be allowed to do that. And nowadays we have so much technology, we can go online and satisfy your questions that, listen, patient A, this is your asthma, this is how I'm diagnosing, and this is my treatment because that is approved by American Lung Association. And that encounter should be over right then. Then I have made my diagnosis and I'm done. Instead, I have to go back and spend another 10 minutes documenting all that or justifying my treatment.
And the trick to that is, and the real evidence of that is the next patient that you're seeing is waiting for you to do all that documentation.
Correct.
And they say, well, the answer is, why don't you just do all the documentation at the end of the day from 6 o'clock till 10 o'clock at night?
Right.
Why don't you? But doctors are willing to do that, but they can't remember in detail
Correct.
all of these details that are going on with each patient. And you want to document, you want to have medical records
Right.
that are accurate.
Documentation would be good if it is medical. No doctor.
Oh, there's so many click in the boxes.
Right. No physician wants to not document proper detail. But that's up to the doctor. We are trained, Dr. Flynn, highly trained scientists. We know what to write. Sometimes I may write one line based on my judgment. I am a specialist. Or I may write a one paragraph. But that should be my prerogative. Government or insurance has no business telling me that do this and this. And that's where the problem is then you start, fabrication comes in. Because this electronic health record is a joke. It was just imposed on people for no medical reason. So now there are so many templates in it, so people click, nurses click in, doctor buy. So your one paragraph document becomes 10 pages. And nobody can understand.
And nobody reads it.
Nobody reads it because there is nothing to read. It's all repetitious. So I would rather say, I examined the patient, I heard wheezing, and he has allergies to pollen, and that's why he has asthma, because he has symptoms like this. 5 minutes. And it could be a clear impression, asthma, allergic asthma, pollen-related asthma, in my treatment. Instead of that, you look, man, you will get a book, and you will not know what exactly patient has.
Well, I noticed in the title you have $3,000 in health care for all in America. What is the right way? What is the $3,000 we're talking about?
The average Medicare patient, and I keep coming back to Medicare.
Medicare patient.
They are the driving force. CMS basically sets the rule for payment, and they control the policy, and everybody else follows. Blue Cross, Aetna's, and United of the world. They follow CMS policies. So CMS is a big daddy. So let's go there. Average Medicare patient, when you get 65-year-old, you have to pay premium about $135 to the Medicare. That gives you 80% of the coverage according to the law that was passed in 1964. Then for 20% coverage, you have to buy secondary supplemental insurance. And there are I think there are C, D, E, F, bunch of plans,
right.
And you end up easily paying $200, $250. So that and $135, that's about $350 per person.
Per month.
Per month. Mm-hmm. So in a year, you come out about average $3,600. That's where I came from. Mm-hmm. That Medicare patients, sadly, let's say you are a healthy Medicare patient, 65-year-old, there are plenty of healthy people who just need a couple $100 worth of physical once a year, and they don't have any other need. But they are in that grinding machine. You enter 65 and you are being grinded at $3,600 year after year. You just have to pay, and until you die. There is no way out of it. Mm-hmm. And what it does, I have observed over years, creates entitlement mentality. Like at some point, people start thinking, well, I'm paying so much money, and what do I get? So they say, well, I'll go get this done. I'll go get this done. And that's what the cost escalates. I mean, the average Medicare patient is visiting more than 6 doctors per year. And each doctor, let's say they have a 3 or 4 month visit, you're talking about 25, 28 visits per patient. And every physician, there's no connection. This electronic health record, another sad thing is they don't talk to each other.
Oh yes, yeah. Everybody says when electronic health records came out, they said, well, if you're here or if you're in Los Angeles or if you're in New York, they'll be able to pull up your health record and read it. That doesn't happen.
That's the biggest hoax.
That doesn't
Your
happen.
practice could be next room, and I have to send my document. I cannot. My nurse has to print it, stack up document, then fax it. So I have 30 pages printed. After fax, they go to waste. Your fax machine receives 30 pages that you don't know what to do because your system, which is different electronic health record, doesn't accept that data. So you look at it, glance at it, and you trash it.
We scan it in,
Yes.
and then we trash it.
Right.
Yeah.
And when it gets scanned, many times it gets thrown in the, unless you are computer savvy, you can't even find that scan. But let's come to that 3,000. So $3,600 per Medicare patient is just constant expenditure. Why not give that 3,000 to the patient instead of system absorbs that money right now, and you never get to see it. So we can easily say, okay, every American Medicare patient has that $3,000 under their control. It's a healthcare related only. They cannot be used to buy beer or
Right.
hamburger, just healthcare. And every time they go to doctor for medically necessary service, which can be determined by prestigious organization, that doctor does x-ray, is a medically necessary. So that money goes out of $3,000. And when that is exhausted, then Medicare kicks in. So until then, patient will become very, I think, cost conscious. Now they have skin in the game. They don't want to just visit 6 doctors. They say, well, maybe I don't need to go and have all these things again and again. So because I want to save 3,000. Every year that money becomes yours. And health savings account failed because it was a rollover plan.
Mm-hmm.
So you really don't get that money back. It goes in a pile. So, 10 years you are healthy, you have $30,000 and you go to an institution, they're looking at that 30,000 and they may want to exhaust that budget.
Right.
But in what I'm proposing, just give it back. December 31st, midnight, that money is yours. You can invest it, and next year $3,000 starts again. So now every patient will be cost conscious. They will want to save that $3,000 or anything out of it. Now if you have chronic illness, you may not be able to, but you're still going to have that kind of approach that, listen, I don't want to exhaust my $3,000 all the time. And similar thing can happen in a private, like commercial insurance, because average employer for the employee coverage has to spend, like IBM or Google or whatever, $18,600 per employee for family coverage. And that money is the same thing. It's a gone money. If a healthy guy, 30-year-old, his salary is, for example, $70,000, employer is paying $18,600 on his behalf to the system.
Right.
And the man or woman may not ever use it. My proposal is give that money to the person.
And let
So
them
his
spend it
salary-
as they see it.
That's
fit.
it. And you cut regulations and let people control the money, and you watch America's genius coming in. Everybody's going to have cost-conscious mentality that, hey, listen.
Trust people
Trust
to
people.
manage their
Yeah.
own money, is what you're saying. I believe.
Exactly. Instead of insurance and government deciding that how to spend healthcare, I would know. Americans are smart people, Dr. Flynn, because we buy $5 burger when you want to, or if you have a good mood, you may go fancy place and spend $15 burger. But that's your choice. You're not going to be forced upon. Here, government tells you what burger to eat and at what price. And at some point, boundaries get blurred and nobody's getting a real burger. You're just getting government burger, and which is basically a nothing burger.
You have a story in here about a fictitious patient
Right.
named Mary,
Mm-hmm.
and this actually happened. Maybe it's
in practice.
confluence of
Correct.
things. Can you relate that story to us?
Yeah, Miss Mary is one of real world patient. That she is a smart lady. She's into local politics, so she understands the system a little bit. Her husband is a business owner, steakhouse owner in the story, and she's trusting her Dr. Jones. He's a family doctor. Dr. Jones, his father was their doctor, and actually he delivered Miss Mary. So now Miss Mary and her children, they go to Dr. Jones, and the bill keeps going up, and she doesn't understand that sore throat, $80. My John had a little sprained neck, $120. So she just is concerned that why these costs are so high, and she questions Dr. Jones. And that's where her eyes are open, because Dr. Jones was happy that she questioned, because he said, Mary, even I am not sure why these bills are so high. And she thought he was kidding, but he actually was not, because that's a sad situation that provider and consumer both are in the dark. And that's a true. Like if I see 4 patients in a row as a doctor, I have no idea what I'm going to get paid on each of the patient. It depends on their insurance, what coverage they have, and there's a good chance that after the visit's over, insurance may even deny my services. Now, can you believe that you go to Walmart and buy shirts and walk out, and some third party denies the Walmart?
Later on, they
Yeah.
say, well,
Sir,
You know,
he didn't get the shirt. Well, he did. We have camera. He
oh,
took
you
the-
didn't document it enough.
You didn't
Yeah.
document or something.
But you got a camera. Well, he really didn't need the
Right.
shirt, so you shouldn't have sold it to him.
And you are trying to prove that process, which may end up costing your whole profit anyway. By the time you get proof that, well, the shirt and transaction happened, you have wasted so much resources that if you're going to make $5 on a shirt, that's gone in a process. Same thing. Dr. Jones is trying to explain Mary that, Mary, I don't mind seeing you for $40. For every $100 patient pays in a doctor's office, usually physician actual cost is $60. That's it. $40 goes in a black hole, which is our system. It's third parties, regulations, insurance, and they suck that money up. So patients are paying $40, 40 cents a dollar for no reason. And that's really Institute of Medicine data proves the same thing, 30 to 40% waste. And sad thing is all these jokers, well, that's not a good word, but the leaders, political leaders, are saying, I'll do this, my plan is bigger and better. So you're giving a fat patient hamburger, which is loaded with cheese. Then Mr. Bernie comes, okay, I'll give you burger and French fries. Then other one comes, I'll give you burger and Coke. So you're making patient bigger instead of putting patient on a diet. And healthcare needs to go on a diet. That 40% we keep talking about needs to be extracted. So we have $1.2 trillion in people's hand. And that's exactly will solve the problem.
What cuts would they make to cut this 40% other than
let me give you my own example, or any doctor's office. You go in, see, it's one of the myths that we need all this paperwork. I don't. I mean, you can control your own medical record as a patient. If all American patients are given charge of their own medical record, I mean, you have your email, your bank accounts, your DirecTV, every sensitive data, credit card bills in online, and you are able to do it
everything
anyway.
else is out there
So
except
you control your own record. That saves me $10 right there. So because I don't have complex system anymore, so I can give you, okay, instead of $100, I'll charge you $90 now because $10 you took care of.
Right.
So okay, and you come in and you log in your chart, and I can have my own small laptop and I can write my notes that I as a doctor need to. And end of the visit, I make that note, and if it's not complete, I can say, Johnny, I'll transfer this note to your document tomorrow when I'm completing. And if it is complete now, I can just click it and it will go to patient's. So
Right.
patient's record always stays complete. Patient goes to California or visits Florida and he falls off the ditch, they don't have to call in Tennessee. Where's his record? And waste so much time. It's
well,
right there.
that was the idea about electronic medical records. That was the very idea.
It's
But it
actually
didn't-
made it 10 times worse.
Yeah, I know.
I mean, electronic record, old days was actually better. My nurse could pick up a one-page from a chart and fax it. So and page goes back to the chart, so no paper wasted.
But if the patient keeps their own record,
It's
whether it's
easier.
online or off wherever they keep it,
Cloud-based system or on their phone, because all the sensitive data that, for example, I have on my iPhone is password protected. Nobody can hack into it until I give my permission. So while your record in a Baptist hospital or Methodist, you have no control. Hacker can get into it. So if you own your record, it's much more protected. So that HIPAA law, so-called, which is created for privacy, it's really failing people because your records are everywhere. Everywhere. As a patient, your insurance company can come and look into your record
and they're open to online hacking.
Online hacking, and you may not even have idea that 10 people have looked in your record. Your insurance people, your pharmacy, everybody has access. Anybody who's handling your money can look into those records. So that 10%. Now payment, like we explained earlier, that once you get done, somebody is paying for your bill,
Right.
and I'm chasing that money forever. I may get, may not get, but if you say, okay, I'll take care of my payment. Now, medical record was one, payment is another. There goes another 10%. Because I have to not invest so much energy in a system that will chase money. So now $100 bill becomes $80. So $20 is saving right there.
Right.
And that's where, once this thing starts, this cascade, all the other overhead will go down. Because right now, physicians have to hire so many people.
Yeah, you had to have record
manage the whole
clerks, you had to
system,
have
yes.
everything.
So, and physicians are trained to be scientists. They are healers. We want to heal people and your pain or your illness. I don't want to be in a business of having employees that I have to manage and hire office manager, and then I have to have workman's comp, and then I have to have this insurance liability, and it's crazy. So all that structure can shrink. That's another 10%. So easily any physician, if you give them a free freedom to treat according to what they are trained for, you will easily save 40 cents a dollar. And the myth is, I have to have elaborate structure. No, insurance has imposed. I can see a patient for asthma, for example, if he's stable, in my home, or even a parking lot in the Walmart or Starbucks. What's the big deal? If I see you for high blood pressure, for example, and then you have a follow-up visit, it can be anywhere in a friendlier, and it's a zero cost. Right now, there's a humongous overhead cost because you have to be in a structure because of regulations or fear of malpractice and all that. But I can say, hey, Mikey, I seen you today, give you a thorough exam. I'm ordering a couple of tests. All we need to do is you need to come back in a month to see if the blood pressure is getting better, and I'll discuss. And you can come to my house. On Friday, I see all these visits on Friday at my home. That's it. So because that day, Michael is just coming to review the data. He comes in, he lights up his chart, and I go through his test results and check his blood pressure is working. Zero cost. So easily I can make that $100 visit 50 because I'm doing it in my home. So if we do all this innovative stuff and give people and physicians power, and nurses are so good in this country, they can help monitor this process so patients don't get shortchanged. Because there are, bad apples in our business. Some physician may try to, for example, use the system to cheat the patient, for example, of time. But good nurses can monitor this. We can allow nursing staff to kind of create a red flag if that's what system is afraid of.
Right.
There's no fraud after that. Because I hear all the time that, well, there'll be a fraud. They will see for 5 minutes and bill for 10 minutes. As if a physician, no physician is like that. I mean, I don't know anybody, but maybe the 10%, for example, you just have to have a number. Maybe you're afraid of doing that. Well, let's have nurses and patients give some power. Patients are not stupid. If I see you for 5 minutes and I charge you for 15, he's going to raise a voice, and next day, or he may not come. That's the free market work.
Yeah.
You go to a bad place and eat a bad burger, you're not going to go
You don't
there
go
again.
back.
Right. So they'll fall out on their own. But fear that, oh, you don't know Johnny, you little American, Johnny don't know, we will control. And there you go. Johnny surrenders his power to the big daddy government, and you are screwed. because then layers and layers of regulation comes in and nobody knows who is getting protected, but we do know that pockets are getting filled on the other side, because hospital CEOs in this book, you will be amazed. I was amazed when I researched. Their salaries have gone like 80-90% up in last 10 years.
Yeah.
So why? Because they are good in using the system. So CEO's job nowadays is not to take care of the people in their community. Their job is to find money from the government and system and programs, so the more and more money flows into the institution they are working for, and they get fat bonus out of it.
Well, you certainly present a good case for the right way to have health care in America, and we're looking forward to this coming out, and we'll give everyone a notice when it does come out so
Sure.
that they can get a copy of it. And meanwhile, if you present it in an ebook or anything, let us know, because we want to it's a nice read. It's a fun, very enlightening, and I enjoyed the read.
And these are very difficult concepts. So we had a short time, but if you read the book, you can understand, because this system has been set for such a long time. So it's average patient cannot comprehend what I'm talking about today.
Well, a lot of doctors can.
Right. So
And-
reading will be the best way to understand that how corrupt and porous the system is. And bottom line is, we are getting shortchanged with $1.2 trillion in America. And that money goes back in the pockets of Americans. This country will be different.
Got you. Thank you, Dr. Yogi. Thank you very much for being here with us and explaining this, because you come from a very practical point of view. Yes, it is from the doctor's point of view, but it's how it affects you, the patient. Why you can't see your doctor as much or as long as you can anymore. And I believe the big word is the R word, regulation.
Regulation. And as a doctor, how can I give your $40 back?